Librela and Solensia. Drugs designed to eliminate pain may also eliminate the body's ability to protect itself. In dogs and cats treated with anti-NGF therapies, emerging concerns suggest that the absence of pain signaling may not just mask disease but accelerate it, with effects that can persist long after the last injection. NGF blockade and its biological role. Nerve growth factor, NGF, is a critical neurotrophin involved in survival and maintenance of sensory and sympathetic neurons, pain signaling via TRKA receptor activation, tissue repair and inflammatory modulation. Anti-NGF drugs function by neutralizing circulating NGF, thereby preventing activation of nociceptive pathways. However, NGF is not solely a pain molecule. Its inhibition disrupts multiple physiological systems beyond analgesia, mechanism of action and systemic disruption. Anti-NGF monoclonal antibodies bind free NGF with high specificity, prevent NGF TRKA receptor interaction, reduce peripheral sensitization and central pain signaling. Consequence: this creates a functional denervation of pain pathways, which removes protective nociception, alters joint loading behavior, interferes with neuroimmune signaling. Mechanisms behind adverse effects. Rapidly progressive osteoarthritis, RPOA. Mechanism: pain suppression allows continued or increased use of damaged joints. Loss of protective pain reflex leads to mechanical overloading. NGF inhibition may impair chondrocyte repair signaling, subchondral bone remodeling, synovial homeostasis. Result: accelerated cartilage degradation, joint collapse, or structural failure. This phenomenon has parallels in human anti-NGF trials, where RPOA was a major safety concern. Neurological effects. Observed signs: ataxia, proprioceptive deficits, weakness. Mechanism: NGF supports peripheral nerve maintenance, axonal regeneration, sensory neuron survival. Blocking NGF may lead to subclinical neurodegeneration, impaired nerve repair after minor injuries, dysfunction in sensory feedback loops, immune-mediated and hypersensitivity reactions. As monoclonal antibodies, these drugs can trigger anti-drug antibody formation, potential immune complex deposition. Mechanisms include type 3 hypersensitivity, immune complex mediated inflammation, cytokine modulation altering immune balance, delayed and persistent effects. One of the most concerning aspects is persistence beyond drug cessation. Why effects may continue. Long half-life. Monoclonal antibodies remain in circulation for weeks to months. Continued NGF suppression after last injection. Structural damage. Joint destruction, for example, RPOA, is irreversible. Mechanical deterioration continues even after drug clearance. Neural remodeling. Chronic NGF suppression may induce synaptic changes, altered pain processing pathways. These changes may not revert quickly. Behavioral reinforcement. Animals adapt to increased activity levels during analgesia. Continued overuse persists even when drug effects decline. Spread and progression of damage once initiated. Damage may propagate through biomechanical cascade. Joint instability gives altered gait, gives overload of adjacent joints. Secondary osteoarthritis in previously unaffected limbs. Central sensitization disruption. Pain pathways are not simply turned back on. Dysregulated signaling may delay recognition of new injury, alter pain thresholds permanently, inflammatory feedback loops, joint degradation, releases cytokines and matrix fragments. These perpetuate inflammation independent of NGF evidence and controversy. Concerns about NGF inhibitors are not hypothetical. Human trials of anti-NGF drugs were previously halted due to joint destruction risks. Veterinary post-marketing surveillance reports include neurological adverse events, mobility deterioration after initial improvement. However, causation is complex. Underlying disease progression versus drug effect is often difficult to separate. Controlled long-term mechanistic studies remain limited. Key scientific concern. The central issue is not simply side effects, but mechanistic contradiction. Pain is a protective biological signal. Eliminating it without correcting underlying pathology may permit accelerated structural failure. Anti-NGF therapies fundamentally alter pain perception, neural maintenance, joint biomechanics. The resulting adverse effects, particularly joint destruction and neurological dysfunction, can persist or progress after treatment ends, driven by irreversible structural damage, long pharmacokinetics, disrupted neurobiological systems. This places these drugs in a category where absence of symptoms does not equate to absence of disease progression.